Hello, I'm Sheila Marie de la Cruz from BSN1B, and for today's video, I'm going to demonstrate the cleaning the wound and applying a dry and sterile dressing. But before I start, I just want to emphasize that the materials I will be using for this demonstration are only improvised or substitute. Before proceeding, I first check my doctor's order for wound care. Also, I am done assessing my patient for possible need for non-pharmacologic pain-reducing interventions or analgesic medications before wound care and dressing change. Also, I am done washing my hands. Then, reminder, do not forget to wear PPE if indicated or if necessary. Next is identify the patient by the two identifiers, which is saying her name and birthday. Also, do not forget to provide privacy and comfort to the patient by closing the doors or the curtains and diminishing the room noise. You can also adjust or raise the bed for appropriate working height, which is usually the elbow height of the nurse. Another thing, do not forget to assist the patient into a comfortable position, which also provides easy access to the wound area. So these are the materials that I will be using for this demonstration: cleaning solution or alcohol, clean gloves, pen, gauze, waste receptacle, towel, micropore tape and scissors, basin and container. Also, I will be using a sterile gloves for the dressing change later.
The first thing to do is to place a waste receptacle or bag at a convenient location for use during the procedure. Check also the position of the tubes, drains, or other adjuncts before removing the dressing. Then, put on clean disposable gloves and proceed to the wound care and dressing change. The first thing to do is to put the towel or blanket under the wound site. Then, remove or loosen the tape on the old dressing. If necessary, you may use an adhesive remover to remove the tape. Then place it on the receptacle or the waste bag. Then carefully remove the soil dressings. After removing, note the presence, amount, type, color, and odor of any drainage on the dressings. Place the soil dressings into an appropriate waste receptacle. Inspect the wound site for size, appearance, and drainage. Assess if any pain is present. Check the status of the suture, adhesive closure strips, staples, and drains or tubes if present. Remove your gloves and dispose it to the waste receptacle. Using a sterile technique, prepare a sterile work area and open needed supplies. Put on sterile gloves. You can follow the open gloving technique. Now, open the sterile cleaning solution. Depending on the amount of cleaning needed, the solution shall be poured directly over the gauze, over a container for small cleaning jobs, or into a basin for more complex or larger cleaning. The next thing to do is to clean the wound. Clean the wound from top to bottom and from center to outside. Following this pattern, use new gauze for each wipe, then place the used gauze into the waste receptacle. Once the wound is cleaned, dry the area using a gauze sponge in the same manner. You can apply ointment or perform other treatments as ordered. If a drain is in use at the wound location, clean around the drain. The next thing to do is to apply the first layer of dry, sterile dressing over the wound. Note, forceps may be used for applying the first layer of the sterile dressing. Then, place the second layer of gauze over the wound site. Secure the dressing by putting tape, Montgomery straps, or roller gauze onto the dressing. You can also apply a surgical or abdominal pad ABD over the gauze at the site as the outermost layer of the dressing if available. Remove your gloves and dispose it onto the waste receptacle or waste bag. Then after that, label the dressing with date and time, also with the signature of the nurse. Remove all the materials or supplies that you have used in the procedure. Then place the patient back into the comfortable position with side rails up and bed is in low position. Then next, remove your PPE if used, then also perform hand hygiene. Check all the wound dressing every shift, then do not forget to document all the information. That's it for the cleaning of the wound and applying dry sterile dressing.